Such a great experience in the field of public health. So, in fact, how do you see the role of ethics tying with the principles of public health?
Well, I think that the issue of ethics is absolutely completely intertwined with public health, both in program implementation and in research. It's very, and it has been since the beginning, these ethical issues, and particularly this is true in public health, because the tension between the rights of the person, the rights of the society, we can talk about that because my area is infectious diseases, and in that particular field, the interaction between ethics and programs and implementation and so on is very, very, very intertwined.
Yeah, is it in, as you said, in the infectious disease context, we had a history of quarantines as a way, and some of the films also talk about it in a completely different fashion.
Sure.
So what was the history of quarantine in one way, and how it actually shaped the public health practice in terms of?
Well, the whole concept of quarantine actually goes back to the bubonic plague, the plague in Europe, and the boats would come into the harbors of Venice. I'm not sure when it was, 1300s, and they had to stay, and the people on the boat had to stay at sea for 40 days, quattro, and then if everybody was fine, then they could come on land. So that because of this great fear that they would bring the plague, they didn't know what caused it. They weren't sure. Obviously, they didn't know anything about bacteria, viruses, or any of this sort of stuff. But this concept of keeping people away from others has a long, long, long history. Oftentimes, it was people who were sick who were kept away from others. But there's a long history of going back. Oftentimes it was abused, of course, that they would, that there were, society would oftentimes punish or even kill individuals who they thought were bringing the disease into the community. Now we are beyond that, but we still have these issues.
So when was it raised as an ethical concern in the field of public health?
Well, my guess is it's been there for a long, long time, but it is recently that we have talked about the whole issue of if somebody has a disease, we want to, and we're afraid that it will spread to others, and we're afraid of what that disease will do to others, we isolate them. We keep them away from the community. Quarantine is the notion that you have been exposed to somebody who's sick. You may feel well, but they keep you away from others. Now that's even more difficult. It's one thing to keep somebody who is clearly sick, coughing, have lesions on themselves like smallpox or something. But what about people who've just been exposed? And then how long do you quarantine for? Well, you quarantine for the period of the incubation period. But sometimes with new diseases, we don't know what that is. You know, it's 1 week, 2 weeks, 3 weeks, and so on. And then there are all sorts of notions of what can that person do to others. We still suffer from this idea of we want to blame the victim. So you're ill, and it's sort of your fault. So we keep you away from others, and so on. So there is still a lot of ethical issues with regard to the protection of the rights of the individual versus the rights of society. And how much can we restrict the rights of the person to protect society? What are those ground rules? Well, there are now a set of ground rules. They're sort of embodied in something called the Syracuse Principles, which say, well, if we're going to isolate you or quarantine you, there has to be a good medical reason for it. We can't just do it because we don't like the way you look or your lifestyle. Secondly, so there has to be clear evidence. We can't do it simply because of other reasons. We also, it has to be, whatever we do has to be related to the sense of how severe this illness is. What are the consequences of you spreading it? Also, do you have a right to say, I don't agree with this? Can you bring it to a court of law? So we now have a set of principles that are designed to protect the person, but at the same time try to protect the state and the society. And this is true with, of course, a lot of public health issues, but it's particularly true for infectious diseases.
So within infectious diseases, quarantine applies true for foodborne, airborne, or it was originally meant for only airborne infections. Is there any?
Well, it's spread to other things, but it has a particular role in the area of airborne infections. If you have an illness, but the only way I can contact it is if your blood mixes with my blood, then the issues of quarantine are less severe. But if you're coughing, can spread this, then you increase the consequences of you infecting others, and the ability for you to infect others is much greater. So we're much more concerned with airborne infections than with bloodborne infections. But in the early days when we don't know, then we do all sorts of things. So in the early days of the AIDS epidemic, people wanted to quarantine, to isolate, to essentially blame the victim. With a lot of infectious illnesses, there is a tendency to blame the victim. It's your fault. If you hadn't done this, if you hadn't done that. And biblically, we can go back, the leprosy patients, when they wandered through the villages, they had to carry a bell with them and ring, 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 and so everybody ran away from them. Now, they weren't so much afraid, I suppose, maybe they were afraid of being touched and so on. But airborne infections have a whole other, there's a whole other possibilities increase. And that's what concerns us. Now, some don't spread very easily. Some
very fast.
Like flu.
So
we have flu in Hong Kong, and it's around the world within 2 or 3 months. Boom. And we are so connected. In the days when quarantine was first developed, it was by ship, or you went over that. Now you can go from Bangalore to Boston in less than a day. And that's well within the incubation period of a lot of diseases.
Has there been any recent ethical concerns towards quarantine in the last 150 years?
Well, one of the recent outbreak of Ebola has raised a whole set of other issues. Because again, this is a condition which, at least in the African context, had a very high mortality. 40, 50, 60% mortality. So the issues of quarantine of the individual, or isolation of the individual, and quarantine of those who've been exposed, carried with it a tremendous importance. However, oftentimes in our reaction to this fear, we can even drive the epidemic underground and make it even worse. For example, in the early days of this big Ebola outbreak of 3 or 4 years ago, there was great fear that people who had contact not just with a patient, but with a corpse, with a dead body, could pick up the disease. So there was tremendous pressure put on families to give us the body and not bury it.
Bury
Don't
it.
get involved in the burial.
Mhm.
Because every society has rituals that they go through
Yeah.
to prepare the body for burial or
Yeah,
cremation or anything.
Yeah.
So, but the fear was that in that preparation,
Mhm.
you could pick up the infection. So they wanted to take the body away. But the handling of the body and the ritual
Rituals.
that every society has,
Mhm.
whatever their religion, is very powerful. And if that ritual gets in the way, I mean, your major role in life may be to take care of the person for the next life.
Yeah.
And now I'm saying to you, you can't do it.
Yeah.
Give us the body. And not only do we want you to give it to us, we're going to wrap it up and throw it in the ground.
Yeah.
My
It's
God.
interfering with the cultural rights.
So then people said, well, no, we're not going to tell you when we have a death, and we're certainly not going to give you the body. And this led to certain spread.
Yeah.
So dealing with these issues are not just simply a matter of setting up rules and regulations. They must take account of the culture and the people, because public health can only work if the public
Yes.
agrees. If the public says no, then it's no,
Yeah.
right? So
This also happened in the recent Nipah epidemic in Kerala. The
Exactly.
Burial of the body as
exactly.
serious,
And
yeah.
so how do you deal with someone who's sick? Not only someone who's sick, someone who dies.
And then even the burial was done by the state. without-
And so and if it so interferes with the culture's sentiments and beliefs, people won't give you the body. They won't tell you that they're sick and so on. And so your whole approach to control becomes a very, very difficult one. So the whole notion of quarantine and isolation and so on are deeply dependent upon our understanding of the cultures that we're dealing with. Very, very.
Yeah.
So you cannot, we want to reduce all of these things to do's and don'ts. But the do's and don'ts have got to...
It has to be in terms with the societal do's and don'ts.
Exactly. Because if people don't want to agree, then
You cannot do it.
you can't do anything about it.
Yeah,
And I think that we are increasingly sensitive to these issues. We still make mistakes and so on, but the one thing you don't want to do is to drive the reporting of disease underground, because if you do, they're not
Then
going
you
to
can come out.
people aren't going to come forward, and so.
Yeah, in fact, it's interesting to have a discussion quarantine. How do you see the role of ethics in prioritizing public health interventions?
Well, I think it's there's another dimension.
Yeah.
Before I do that, I did want to talk about, since we were on Ebola, talk about one other thing, and that is the dilemma that we are now facing when we have a disease that's very severe. Okay, who should get treatment? Who should get the vaccine? And what if we don't even know whether the vaccine works or whether the treatment works? So there are a whole set of ethical issues, that were in fact addressed by WHO in a number of conferences on who gets, if you have a limited amount of vaccine, who gets it? The health worker? The family? Then there are ethical issues on how do you even test the vaccine. Same thing is true with medicine. So again, a whole set of ethical dilemmas has arisen with these new and re-emerging diseases for which we may not have a vaccine, which we may not have a treatment, or which we may not know whether this works or doesn't work. Now, I'm sorry to do that, but let's go back to the question you asked, was what about ethical issues and priority setting? Well, the group up in Seattle under Professor Chris Murray has tried to look at this whole issue of global burden of disease. And they have looked at, they have combined morbidity and mortality and come up with numbers that say this is how many days of life are lost to this particular condition. The dilemma occurs when, in fact, those numbers don't reflect what society wants. Let me give you an interesting example. We're putting a huge amount of money and effort into polio eradication. Now, people in many parts of the world say, well, why? There's no more polio. Well, what do you... we got a lot of other problems here. We got problems with diarrhea, we got problems with TB, malaria, whatever. Why are you putting all this money? He said, well, because we want to get rid of the vaccines. We don't have it anymore. So, if you look at the global burden of disease, polio is not even in the top 500. And yet we're putting in billions of dollars to try to eradicate this disease. This is the problem with eradication. Because ethically, should we be putting in this money? Because even when we eradicate, if we eradicate polio, and it's my belief we won't, I'm not in the majority here, but I think we will.
Go with it.
Because there are vaccine-derived polio
is already increasing much more than the actual polio.
Again, because of societal issues. Wherever you have a breakdown in governance, where you have war, where you have civil disruption, like in Venezuela, or war in certain parts of Pakistan and Afghanistan, the borders there, it becomes very hard to
ensure the coverage.
Ensure coverage because your workers are vulnerable. You know, there have already been, I don't know, 50 vaccinators who've been killed because of tensions, and I won't get into all of that. But and so this idea of, well, we're going to eradicate it, and let's say they do, let's say they're able to do it, that won't eradicate infantile paralysis, by the way, because there are other viruses which can cause it. So we may eradicate polio, but we won't eradicate infantile paralysis. As I say, I don't think it's going to happen, not because people aren't putting in a huge effort, or they're not trying, they're not developing new strategies, but sometimes Mother Nature doesn't always cooperate.
So that's an interesting...
But that said, we've accomplished an incredible amount in getting rid of polio.
Well, the reduction aspect.
But what about the ethics of pouring in all of this money? What about these other conditions which are killing lots of people?
When it comes to polio, you mentioned about the vaccination. What has been the global evidences on herd immunities at large? Because there has been some ethical consideration by Fein and all, which also argues that herd immunity, especially in the context of measles, we need a desired coverage even to achieve it.
Right. Well, first of all, I reject the term herd immunity. The reason is that you may be protected because everybody in the room is immunized, but you're not immune. Because if you step out of the room and there's somebody there, you're going to get sick. So you see these herds of buffalo, and there's a little baby buffalo. That baby buffalo is protected by the herd. But if that baby buffalo wanders over here, the lion's going to kill it. So I would prefer the term herd protection, because you are not immune, you are protected. Now, for measles, you need to get 95% coverage for herd protection. Okay? But as I say, if you leave the herd, you're not protected anymore. You are vulnerable. Okay? There is now talk...
In the globalization context, the chances of leaving herd is much higher.
Well, look at what's happened in Venezuela. Latin America was considered measles free. Now we have major outbreaks in Venezuela, and that has moved, not to a great degree, but to some degree, into Brazil and Colombia and so on. So, because it's very hard to maintain a 95% coverage. Now, why did the outbreak occur in Venezuela? Because immunization rates went down, because of civil disruption, the public health system was badly affected by it, and so on. So that the vulnerability, particularly with measles, which has a very high infectivity rate called the R0. So it's extremely infectious. So even in the United States, there was some people, there's a whole notion of vaccine deniers. You say, I don't want it because it's against my beliefs, it's not natural, blah, 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 blah. And so they don't immunize. Okay. Now here's another set of ethical issues there. Because what about these people who don't want to immunize? And let's say you have a child who's going to school who has an immune deficiency disease. And that child can't get the vaccine. And I have a child who goes into school and can take the vaccine but doesn't. Isn't my child a threat to your child? Of course.
Yeah, of course.
So do you have both a ethical duty? Do you have a duty? Do I have a duty to make sure my child is immunized so that your child is protected? Now, where we've tried to impose this, it's been very difficult because people say, okay, then I won't go to your school. I'll set up my own school where you don't have to do this.
Yeah, the individual rights again.
So the individual rights versus the rights of society.
Multiple individual rights even.
Exactly. And so you have this constant tension between what is the rights of society, what are the rights of your child going to a public school, what are my rights to not have to do this, and there's an increasing tension globally. And then there's false information that goes out. For example, there was a doctor in UK who wrote a paper maybe 15 years ago called Andrew Wakefield. And he said it seems that autism is related to the MMR vaccine, all right? So immediately people who stop giving vaccine, many people, because we don't know what causes autism, and now somebody comes along and says, look, it's not your fault, it's this vaccine. Now, study after study after study shows that there's no link. But these ideas persist, and people who push these ideas can be extremely dangerous to others in the United States. So do you think it only happens out here? No. In the United States, there were a group of Somali refugees who've settled in Minnesota, and some child became autistic, was autistic, and so this person and their groups went up there because Wakefield got kicked out of the British medical groups, so he came to the United States. Anyway, so he and his minions went up there and said, look, this is this measles vaccine that you're taking. So they stopped taking it. And guess what happened? A major measles outbreak. And of course, measles does kill every once in a while, and it can cause encephalitis and so on. So the danger of misinformation with people who have another political agenda can be tremendous. Okay.
Yeah. So going back to the priority question, how do you see the ethics in a public policy making? Like, how does governments respond to this ethical dilemma of prioritization according to what could be an ideal way or a way in between Israel?
I think every society has to again deal with it on its own, because the numbers may say that this disease is a priority, but the public says no, this disease is a priority, and so that these ministries and planners have got to link whatever they sell has to be saleable to the public. Okay, so they can base their priorities on what the numbers show, but then they have to sell it. They have to make sure that people
getting the public along.
They have to educate, and they have to convince the public that this is an important issue. I was in a seminar here at the meeting on tuberculosis, and the comment was made by a few that the public doesn't understand how severe this problem is. well, then that becomes a matter of convincing them that it is, because if you're going to start these programs, you can't do it unless the public is fully convinced of this sort of thing. So I think planners and priority setters have to look at the numbers, have to decide, but at the same time
convince the public.
That's right. Now, for example, in these global burden of disease, the issue of mental health has become very important, because when somebody is severely mentally ill and so on, they can't participate oftentimes in the society thing. So it's gone from being somewhat obscure to becoming extremely important. Now, there isn't a family around that doesn't have somebody with some mental health issues. But oftentimes people feel like there's nothing I can do. So why are we putting all this money into this sort of thing? Look at, I can cure this, I can prevent measles, I can cure TB, I can do all of these things. Somebody is.
So you say that feasibility of control is an important ethical consideration.
It has to be.
It has to be. Most of the epidemics.
Well, it's not simply a matter of what the numbers say. It's a matter of what the public feels is important. It's a matter of
what human
effectiveness. It's a matter of, do we have an intervention that works? Do we not have an intervention that works? If we simply go by the numbers, I think we will make a number of mistakes along the way.
Yeah, the last question.
Sure.
In the current context, like in Indian kind of situation, we have simultaneously efforts towards prevention. At the same time, we need curative care also to be looked into.
Of course.
So how do you see the ethical balance? How to struck the chord in terms of having an effective situation in terms of prevention and cure, especially in the context of leptospirosis in Kerala and those situations?
So lepto, I didn't know that. Lepto is a major problem.
Major problem. After the post-floods, it was suspected.
Well, I was in Mumbai. Lepto was a main problem.
No problem. But in Kerala, it was suspected, but it has not happened because after flood, post-flood, there was a huge flood in Kerala.
Yes.
And then doxycycline has been given as a kind of preventive for a larger population.
Oh, I see. So they thought it was going to happen.
It happened so that the larger population was distributed doxycycline as a drug. So now how do you see it as ethical consideration?
Well, I think I'm not sure it's an ethical issue so much as did they take the right decision from a public health perspective? Because the situation of lepto in Mumbai may not have been the same as in Kerala. Lepto in Mumbai, as I understand it, was a very urban problem.
Urban problem, yeah.
Right? In the slums, an urban problem. Where a lot of the flooding, it was a rural issue.
And the two waterlogged areas.
And it's far better economically than the slums of Mumbai. So rats and lepto may not have been a big issue. So the question is, did they, I don't know the data or anything on this, but I question whether or not you should give mass treatment when there is no real evidence that this is a problem. Now, you could say, and again, I don't know, but maybe the planners said, look, based on this, we think it's going to be a problem. But there's also a downside of giving antibiotics. Antibiotics, by the way, there isn't a drug in the world that is not risk-free, that is risk-free. There's always a risk.
Yeah, it's always a side
when
effect.
you take an antibiotic, you change your flora in your intestine. Doxycycline, the sun can affect. So before you start doing all of these mass treatments, you better be damn sure that you've got a problem there. Now, the other argument is, well, we're trying to prevent the problem.
Yeah, that's the argument.
That's
the argument of the
That's the argument.
Yeah.
I'm not sure I would have accepted that, but again, I don't know the data.
Was that a real problem?
But if you tell me that there was no evidence of lepto, then I would have said, well, and to give doxycycline to everybody involved in the flood, I would say.
Because there are endemic areas of leptospirosis historically, not only now. Every year there is a pocket, specific pockets, which is largely to do with the water floods
here in
in
Kerala.
Kerala, yeah.
Well, then I would have focused on that
That
one,
specific area.
that specific area. I would have had good surveillance, looked for evidence of disease, and if we began to see a case or two, then you could consider giving it prophylactically. But I certainly would. I think whenever you give drugs out,
even we have access to comparatively better access to healthcare. So even fewer cases can be even given as a presumptive in that kind of situations, or is it?
but you see, if you recall, many years ago, in Surat, there was an outbreak of what people thought was plague. It wasn't clear that it was plague. And within a few days, all the tetracycline was bought up. People started using it. Of course, who was the first people who bought the tetracycline? Who do you think? The doctors.
The doctors. Yeah. So in the plague, yeah.
And then people ran away from Surat.
Yeah.
So if there was plague, this was a guaranteed way to spread it to other parts of the country. So I think that before, again, this involves the whole notion of fear and oftentimes fear that's not related to facts.
Yeah.
That's why, again, one of the ways to deal with some of the ethical issues and so on is to have good data, good information, and that the government must be there must be a reliable source for that information. Because in today's world, the information spreads so fast. I'll give you an interesting example. Many years ago, when the tsunami hit, I was with some students from Harvard, and we went over to Tamil Nadu, because Tamil Nadu was hit by the tsunami. So the students decided we would raise some money and give it to the fishing cooperative, because many of them had lost their boats. So we put the money together, and they gave it to the head of the fishing cooperative. He says, if you really want to help us, what you'll do is you'll buy fish. We say, well, why? I would think that people would be buying fish because there are hardly any fish. He says, no, it's this tsunami virus. I said, tsunami virus? I never heard of such a thing. Well, something had spread through the internet that the fish were eating the dead bodies, they were getting a virus, and the people weren't eating the fish. Okay? Now, there is no such thing. But this rumor had spread so fast that one of the students whose mother lived in London had texted her and said, please don't eat the fish. So there was no tsunami virus, so they had to go on TV and say, you see, here I'm eating fish. Okay. So it's not simply the spread of disease, viruses, but information viruses.
That's
so how do you deal with that? And this can have enormous economic implications. Right?
Yeah. It's actually in the Indian context now, there is also an argument, there is information viruses of varied kind, fear and scare tactics, which is happening. From your experience across the world on various epidemic, how much was this role of fear throughout, at least in...
Oh, I've seen it in a couple. I saw it in the H5N1 outbreak chicken. So we always focus on the other in terms of stigmatizing, in terms of blaming them for the disease that we're getting and so on. And we have to be very, very cautious of this. And authorities, those who have the information, must step up right away.
So one of the prerequisites of being ethical is to have the right information. Can we say that?
Well, you have an ethical obligation to both know, to be updated, and to counter rumors and so on that are being spread by others. Absolutely.
So
you can't just sit back and say, oh, it doesn't make any difference. Because a lot of harm is done.
In context in which in Indian kind of situation the information evidence lack, even creating evidence itself is an ethical practice of public health.
Yes, I would say that one could say that you have both a public health and an ethical obligation to gather information so that you can counter misinformation. Misinformation can be incredibly dangerous to various elements of society and to society itself.
Yeah.
And whether it's the tsunami virus, whether it's chickens with that, whether it's the rumors spread. There was rumors that was spread during the polio immunization campaign that the vaccine was sterilizing people and so on.
Yeah.
And there are people out there who have other agendas.
Yeah.
So ethics clearly has a huge role to play, both in the prevention and the control and the treatment.
Yeah, in fact, it was a great, to contextualize ethics and its role in the context of public health. Thanks a lot from your experiences.
No,
to speak
thank
about.
you.
It was great.
It's been a
talking
pleasure.
to you. Yeah,
it's been a pleasure. Thank you very much.